Hey, it's Jessica DaMassa with WTF Health. I'm here at AHIP's Consumer Experience and Digital Health Forum, and joining me right now I have David Hoke. He's the Senior Director for Associate Health and Wellbeing for Walmart. So David, happy to talk to you.
My pleasure. Thanks for having me.
Thanks for being here. So, okay, Walmart in healthcare, and there's a lot of curiosity around this. So from a big picture standpoint, I mean, what strategy are you guys deploying here? I mean, how do you guys see yourselves fitting into healthcare? What position do you think that Walmart is going to play? I mean, you kind of are a healthcare company in a lot of ways because you're like a front line. You got a pharmacy in there. People could buy their groceries or food. I mean, there's a lot of, fingerprints in health. So what position do you guys see yourselves playing?
Yeah, I think that's a great question. It's fascinating right now because people are really excited to talk about retail and healthcare. But what's fascinating though is that, and by default, we've always been in healthcare. Yeah. Right, so that grocery, you mentioned that. What about sporting goods? Oh, that's true. Right. What about running shoes? What about apparel? What about wearables? We sell all of those things, right? But as the medical community has begun to acknowledge social determinants of health and the broader definition of health beyond clinical care, that has led them to us. We've taken the other side. We've always sold the goods, but never married them back to the clinical side. So you're starting to see a convergence of the two, which creates a full service ecosystem. So,
which is really how people shop for healthcare. Like I get sick, I go to see my doctor, or I do a health thing, telehealth thing or whatever, and I end up with a prescription. I go, I fill it, and I buy other things that are retail. I buy my cough medicine, I buy my cough drops, I may buy like a humidifier, I may whatever. If I'm not feeling well, or even if I'm just trying to get healthy, I may end up and I may have a prescription or not, or I might be looking for other things like supplements or whatever. So yeah, I think this makes sense to me. So what else though? I mean, this can't be it for Walmart.
Yeah, well, think about that. Let's just tease on that for 1 second. Think about, I bet 100 years ago or 200 years ago, it wasn't normal to get your prescription filled at a grocery store.
Well, yeah,
right. So think about expanding that to the other things you need to be healthy. Right. So that's the same journey we're on. So, so how do you take that and translate those? The question. There's two sides of the equation. One is what I'm going to call lifestyle, and the other is clinical. And those two, what I find fascinating in this whole space is the two are they oppose each other in the way we naturally think about them. Okay. Clinical care is transactional in nature. Right. Think about when you go to consume medical care. It's something scheduled. You show up. Sometimes you wait too long, right? You get poked, you get prodded, you get results, right? And then you're supposed to go do something specific. We're hunting for something, very clinical, very transactional. As opposed to lifestyle, what you eat, how you behave, what you wear. These are very personal decisions, and so you almost have to think of strategies and ways to understand how the mind's working, and that leads you to different ways of engaging people, so they can adopt the behaviors that are most beneficial to them, and then in this case, the core business as well.
So you guys are focusing on the everyday, more or less, and making sure that people have what they need, for the entire support of their everyday health.
Yeah, because really the clinical care consumption is driven by your daily actions. Right. So the more we can try to help you in your daily life, the more we can influence the outcomes on the clinical side. Okay,
so I know you guys are trying out Fresh Try, which is an application for behavior change. And it's focused on food right now, but I understand it can do other things as well. So tell me a little bit about what you guys are doing there, what you're piloting, and you're doing it with your employee population first, right? And so this is cool. This is it's exciting to hear how a big consumer company is piloting innovation in healthcare. So tell me a little bit about this.
Yeah, so people have been trying to do lifestyle change and forever, wellness, well-being, without many results. So in this case, we said, let's go to the science. So we want to say what's really working. There's been an explosion in the sciences around behavior change, neuroscience, psychology, et cetera, behavioral economics. And so we found this group engaged in, led by Dr. Kyra Bobinet, who really did a bunch of really cool stuff with us, right? So they did ethnographic research. They're looking for natural behavioral patterns, and then trying to create software that can also map to maps to the way you normally think, in this case about food. But the way the brain thinks, though, is iterative. See, one of the things we have is you try to change something, and and then you fail, so you quit, right? It becomes demotivating. And the world we've created changes around you, so the habit that worked for you today won't work tomorrow. Okay. So, good example, would be you get a new boss. What made you successful the first time, maybe it was being early and working late or whatever, it doesn't work the second time because this is a PowerPoint junkie or whatever. So you got to find new strategies for the environment you're in. Same thing with food. In this case, food. We know food is universal. So we got into food with her because food is universal. And the way clinicians typically talk to patients around chronic conditions is they lecture them on what they should change. Right. But no one wants to be called a diabetic, or they don't want to be diagnosed with having heart disease. Right. And so that's a message they don't really resonate with, right? It's hard to do that. In this case, we said, let's talk about eating, which is everyone wants to talk about. Everyone loves food. And once you get, me too. And once you get excited about talking about that, then we can lead you through practice, right? Iterative practice into better habits.
Okay, so this is interesting to me because, you guys are obviously, you have a lock on consumer behavior. And so you've decided to focus on behavior change, specifically in health. Why go this route as a strategy for getting into healthcare?
Yeah, well, think about it. So first of all, the other ones don't work. Okay, so let's start with what doesn't work and then do something else.
Yeah. I mean, and you guys are good at this. You know what people buy. I mean, like even on the retail side, you guys are really good at consumer behavior. I'm sure that there are things that you know about me just by looking at me, just by the studies that you guys have and the consumer data that you have that are probably pretty spot on to know what I would buy and what I wouldn't buy. Yeah. So how are you going to leverage that and put that into this?
Great idea. Bundles. Think about bundles. The same way you talked about pharmacy, right? Yeah. Think about bundles. What if there was the ability to bundle merchandise, whether it was food, prepackaged food that was custom made for your clinical condition, right? We marry that with physical activity and wearables, and we pull all that data together that feeds both your lifestyle side, but also feeds the clinical side. We're creating an ecosystem. For the first time, there's an ecosystem where everyone can win if we do it the right way. What do I mean by that? Clinicians can win because now they have a place to send you where they know that you can get what you want. It's convenient, it's everyday low cost, it meets your needs. We're on every corner. Come and get it there, and then we can feed information back to the clinician about how you're doing. So
I'm jumping in on two things that you said there. I'm going to jump in on everyday low cost, and I'm going to jump in on every corner and ask you two separate questions, and I'm sure you can guess where I'm going. So on the everyday low cost part, how are you guys going to do this in healthcare? Because I mean, truly, you're famous for like price rollbacks and everyday low prices, and it's like healthcare and everyday low prices. A lot of times, those two things, doesn't connect. So how are you going to do that? How are you going to apply that?
There's lots of good and interesting data in healthcare that we could have a whole conversation about some of the pricing. But so let's take quality, for example. We have horrible quality measures about clinical outcomes in America, right? And everybody assumes that price equals quality. If you dig into the data, that's not necessarily so.
Well, I think your business has proved that.
Yeah. So first of all, we have to do better with that. But I think that it's also about scale, right? So we've got to decide as a company what we're going to get into and how big. Yeah. And then as we figure that out, I think that ultimately we'll try to take the same approach we've taken to other parts of the commercial goods. It's going to be how can we leverage scale and efficiencies, and then make this a better customer experience.
All right, and then the on every corner part. Yeah, I'm going to ask you about CVS. Yeah. So I mean, like CVS, Aetna, right? I mean, this is the potential, I think, to really disrupt healthcare because they've captured the whole vertical, including like a PBM in there. I mean, like that's kind of like okay, like it's like I don't know. I mean, like that to me has the power to really transform because they really have visibility and data on the entire ecosystem and can start to do all those fancy things behind the scenes. So supply chain wise and like help reduce the cost, from the back end and benefit design and all this stuff. How are you guys going to position yourselves against that? And like, what's your differentiator going to be?
Well, I can only tell you from my perspective. Okay, so
disclaimer.
Lots of disclaimers. I got to do it. Hey, come on, we got to play the game, right? But what I would say to you is we have a couple of advantages that they don't have.
All right, tell me.
That no one else has. One is our people. Okay, we have 1.4 million associates working for us in the U.S.
Okay, and those are the people you're focused on.
That's right. Well, not only that, but that gives us the world's biggest private health plan. That's right. Okay. So no one has that petri dish. Okay, and we are more like the rest of America than anybody else that way, right? So we are generalizable. So we can learn from them. Now, don't forget, they also have family and friends, if you didn't forget that, which means there's a multiplier effect. So there's probably about 3 to 4 million of them, right? Yeah. Most everybody in America knows someone who works for or has worked for Walmart at this point. So I think it's a couple percent of the workforce. So think about that as an advantage. If we can take care of them right, and we can serve all your needs, not just the clinical ones, we're home base. These other ones, if you're a pharmacy and you're PBM, that's still only half the equation. Remember, you go there when you're consuming healthcare, right? You don't go there every day, hopefully. Now that's if you're maybe you want to be, right? But we don't want everyone to go there every day. So I think we have a one-stop shop that truly can fit all your needs. They have a great clinical vertical that they can take advantage of, and they have great footprints, but not nearly as broad as us.
So you're banking on the everyday life angle as opposed to like the specific when I'm sick or when I'm
talking about today.
Well, that's fantastic. At least we got you to say that. Right. All right, so last question for you. I mean, I'm curious about you obviously you're focused on engaging your employees, your associates, in this pilot program with Fresh Tribe, which is focused on right now good behavior or changing behavior and patterns and habits as far as eating is concerned. I know you've just rolled out, but can you talk to us about any of the early outcomes that you're seeing?
Yeah, I mean, I can tell you what we're learning right now.
Yeah, tell me.
So we've married this. One of the things that we're doing is we're looking for natural adjacencies, so product bundles, if you will. So how does Fresh Try and teaching people how to eat better tie with our fresh product line? Okay. How's it tie to other clinical services or other things that we're doing in the company? And what we're seeing is that people that are most successful, especially in weight loss, are people that have adopted this iterative mindset, which they can be learned through the Fresh Try application, right? So really it's about, and Kyra can talk about this in detail, but there's some neurosciences around how we track failure. So it's about how do you teach the brain not to count a lapse as a collapse, right? We want to turn it into something that you can learn from and iterate on. And that's exactly what this teaches you to do, which is why it's so universally applicable.
Yeah.
But what we're seeing is people that adopt that mindset and adopt the fresh, try pattern, they actually have much better long-term weight loss outcomes than people who don't.
Okay, how are you applying that though, like with these bundles, like with what people are buying?
Yeah, so we're working on two different angles for that. One is how does it integrate with our fresh, right? Everybody in America knows they should eat more fresh fruits and vegetables, so why don't we? Right. So how can we teach people? So think of even consumer behavior in this case, buying fruits and vegetables and using them as a behavior problem, not an education problem. Yeah. Right. So how do we link the two together? So there's ways we're trying to do that. I'm not saying we've been wildly successful yet. We're going to fail a bunch of times first. Yeah. So that's one way we're doing it, and the other way is linking it to other wellness or well-being programs we have for our associates. So there are other things we can buckle this to say, hey, if you're interested in weight loss, put this into your portfolio of tricks, and it helps you work better. The key to that for us, what we've learned, is it's all about emotional connection and authenticity. So I know there's a big buzz around storytelling right now. Yeah. You're really good at it, by the way. But but that's really, if we can find authentic stories where people have used it as a model for others to emulate, then we crowdsource solutions, and that's really where this all emanates from. If we crowdsource solutions, I can learn from you informally, apply that to my life with an iterative mindset. I'm more likely to be successful.
There's so much to learn from you guys. I mean, even just hearing you talk about your process and your thought process, it's like just about how you tie consumerism back to behavior change. I mean, and just this iterative mindset and, kind of like failing and quickly readjusting. So much for us to learn from you guys here in healthcare. So thanks, David. I mean, pleasure to talk to you.
Oh, my pleasure. Thanks for having me.
Thanks so much. This is Jessica DaMassa here at AHIP's Consumer Experience and Digital Health Forum for WTF Health. Thanks for watching.